The data that I presented today was over 4 years of experience with this treatment. The first 6 months was what we call a dose ranging study. So 2 different treatment arms, and then there was a comparator group, which was the untreated group of patients. And after 6 months, these patients got rolled over into the extension phase, or all patients now started to receive treatment. And based on the data that we learned from the first part of the study and then also from pediatric data, the dose was adjusted from a lower dose of 0.3 to 0.5 milligrams per kilogram per day to 1 milligram per kilogram per day, 6 days of the week. These data were of course collected in an open label fashion, but the results, I would say, are fairly impressive, with marked improvement in the ability of these individuals to function as measured by the 6-minute walk test. So 5 out of the 19 individuals needed some kind of assistive device at baseline, and by the end of 2 years into the study, all 5 of them had improvements. 3 actually did not need an assistive device, and 2 of them downgraded from the assistive device that they were using. In addition, there were biomarkers of disease burden, which also reduced significantly. And so overall, going along with the biological mechanism of this treatment, which is the recombinant enzyme, that it does reduce the levels of the pyridoxal phosphate and inorganic pyrophosphate, which are both increased in the extracellular compartment in the untreated patients with HPP. Well, in a way, I would say it was very exciting to see the kind of clinical response that we saw, that some individuals who had as many as 30 fractures in their lifespan during these 4 years on study did not experience any fractures. But the other important part is that they all really talked about an improved quality of life, a reduction in pain, ability to go back to their activities of daily living. So this was really a very reassuring part of the study, that you could measure and capture change in adults with this disease.